The Kaiser Family Foundation presents health08.org, election news, analysis, and events.
Reverend Heyward Wiggins with the PICO National Network, thanks for joining us today on health08.org.
Thank you, Jill.
So before we get to PICO and some of the issues that PICO deals with in terms of healthcare, tell us about the community where you are a pastor and some of the issues that your parishioners and other community members deal with when it comes to accessing healthcare.
Well, I live in an area called Camden, New Jersey, and Camden is, many people might know that Camden is considered one of the poorest cities in the United States. And also it has an area which is looked at as being one of the most violent areas. And so we face those elements, those elements kind of transition into people not having jobs, and not having jobs means not having great coverage in health care, which the problems usually land in the church community to solve many of the problems. And I've been pastoring there for about 11 years now. And I have a lot of people in my congregation who have health coverage issues. And so normally when they run out of resources, like I said earlier, they come to the church. I even had an instance last night where that occurred, and we had to help one of our members out in a health issue.
So what do you do in an instance like that? What are the resources you have available to you to help out?
Well, it's our internal resources, and then there's also in New Jersey, there's charity care possibilities as well for individuals to access. And many of the times they run to the emergency room for their care because they don't have health care coverage. So normally they're one of those two avenues, or we just wind up having to come out of our pockets to help someone.
Now, PICO is a coalition of faith-based communities, and you are a member of their steering committee. In terms of PICO's vantage point, what is the number one issue facing our healthcare system today?
The 47 to 50 million people who are uninsured, and 9 million of those are children who have the possibility of being covered under SCHIP as well. And not having a good health care reform process in place. That to me and to PICO is one of the major issues that we face today.
Now, PICO actually has a roadmap to covering all children by 2010. What does that roadmap look like?
Well, we want to make sure that our children are covered, that vital areas of health care are addressed. We need to make sure that it's affordable. We need to make sure that it doesn't affect the national budget. Now, all those things are part of the roadmap that PICO has. We want to make sure that when the reform is in place and that people are covered, that it's something that can last for forever, if you will.
Now, a couple of the elements, one of them is SCHIP. Obviously, you mentioned that there are 9 million children that are uninsured. So how is PICO working on behalf of improving SCHIP, whether it's filling any gaps in SCHIP or even perhaps broadening coverage of SCHIP?
Well, we've been working probably for the last year and a half, 2 or 3 years, trying to fine-tune the bill. We've been here many times. We've had people who have testified in Congress, and we've had many of we've had newspaper articles go out, we've had ads running, and we have really concentrated on dealing one-to-one with our legislators locally and nationally to make sure that they hear our voice and know exactly what we want. We are a grassroots organization, and so the people know what they want better than anyone else. And so we represent them, so we speak these elements to the minds of our legislators to make sure that they understand that you just can't give a broad coverage. You have to make sure that the particular needs are addressed when you're dealing with SCHIP, that the children are covered, that their dental is covered, that all its vital elements are covered in the bill.
And for you, what's standing in the way of that coverage?
I think most of the time it's the partisanship that does occur sometimes here in Washington. And that stands in the way of a lot of things, but to us, that kind of stands in the way. But we've been fortunate, as far as SCHIP is concerned, to have a bipartisan bill that was proposed, which was unfortunately vetoed by a president. But we do have something that still can be looked at. And some of our presidential candidates have talked about, maybe in their first 100 days of office, to reinvigorate this same bill, because it was a very good bill. We thought it was a very good bill. Not perfect, but something that definitely would cover a number of children who weren't covered.
Now, you mentioned earlier with your efforts towards SCHIP that you work with both state and federal policymakers. So for you, what are some of the appropriate roles for both state and federal lawmakers?
Well, I think the state's role would be to really, the states have a closer relationship with the people in the state. So, and they know the little particulars of their state and the organizations who actually do facilitate the coverage. And so their role would be to make sure that that is expressed and to all of the people who would be covered, and to really fine-tune the processes of coverage so that no one's falling through the cracks. The federal government's role would be to make sure that the funding, the resources are there, and to be sort of I guess if you will, sort of a watchdog to make sure that things don't get out of hand. So, I mean, not to be an overlord, but just to make sure that the standards, the quality of coverage is maintained, the integrity is covered.
And we talked about children.
Yes.
What about adults? What are some of the big issues that you see with adults and access to care?
I think the adults, and it's something that we experienced even recently, adults sometimes have issues. And I talked with some the other day. They were saying they had a problem with the fact that the process as far as how they get enrolled were frustrating. And so that sometimes discourages them as far as some people have to, I think after 6 months, have to realign themselves with their coverage, and it's kind of frustrating for them. So making sure that some of those processes are streamlined so that adults can be covered, that the process is easy for them to enroll and to participate. Making sure those things, those hitches are pushed out of the way. I think those are important for adults.
Now, another group that you all work with is immigrants.
Yes.
And obviously the immigration debate has become pretty hot in our country within the past couple of years. How has that debate affected how you all look at healthcare coverage for immigrants and how you educate people about healthcare for immigrants?
Well, as PICO, we're actually talking about some of those issues now, and so we haven't really landed in any particular process. But we do realize that the coverage of immigrants who are here is a vital piece. They're human beings. They have health issues just like anyone else. And so from the moral position, we have to make sure that everyone who is here and in their proper status is covered. We have to make sure that happens.
And do you differentiate between immigrants who are here legally and those who are undocumented? Because that's an issue that's been asked by some of the presidential candidates, and I believe that all of them have said that their plans would not cover undocumented immigrants.
Yeah. We need to make sure that if they're undocumented, that we find a way to get them documented. And because, again, the human element, you can't take that out. You know, it has to be, I mean, if you see a person dying on the street, you're not going to ask them if they're documented or not. You want to make sure that they get some help. And so PICO, which is a faith-based institution, and we have this moral fiber, this thing that drives us, doesn't ask those questions if you see somebody who's laying on the street and needs help. You just want to help them. So if the undocumentation is there, we need to find a way to make that happen, you know, so that they can be covered as well. The human element cannot be taken out.